This is the third episode of the second season, and in this show, we will discuss if healthcare is a basic human right, and we'll also discuss what we can learn from community based care in Africa. But first, some healthusiasm, some positive changes that will impact our health and happiness, and that the Healthusiasm panel wants to inspire you with. So tell me, Aline, what healthusiasm did you witness in the past month?
So I read a very interesting article coming from my beloved country, France. So a team of researchers from the University Hospital of Tours recently published an article showing the positive effects of laughing gas to treat depression. So I found it was very interesting. And they said that it could actually be the next generation of antidepressant 4 or 5 years from now. So the study was made on the women, 30 women aged from 25 to 50. So they first had the MRI, and then they underwent a 1-hour session of laughing gas, and then they had another MRI. And what's really interesting is that nearly half of the women responded to the treatment by hardly showing any sign or no sign of depression weeks or even month after doing that experiment. And so what the researchers were saying is that looking at the brain, they could actually observe like a relief of a certain hyperactivation of some areas of the brain associated with depressive symptoms. So I thought it was very interesting.
That is very interesting indeed. I was laughing all the time when you were talking. Let's go to some other mental health related solutions. I saw recently that there is a growing category of mental health apps that are specifically designed for the Muslim community. Obviously, there is no shortage of mental health apps, but typically speaking, they're more oriented towards Western, psychology in general. However, there's almost, I believe, 2 billion Muslims in the world. And so the idea is that with these new mental health apps, it would be more faith oriented as a solution. And already quite some solutions out there. I think Kalbo is one that I read a lot about. It's written as QALBOO, but it's also Ru, Saba, Sakina, and Mindful Muslim. And so what these apps do is they kind of fuse the modern clinical methodologies with the actual Islamic values, based on the Quran and the Sunnah. But beyond that, they actually connect users with professional counselors, physicians, or even with each other. And this is pretty new. I think it was really, really nice to see how actually, I mean, we started with Nike as well in the past, how suddenly they opened up their entire apparel clothing lines up to this large group of Muslims to help them actually to go out in sporting. And this is what we see now with mental health support as well. It brings people together with their professional counselors, which brings us to Telehealth. And Aditi, Telehealth expert, if I may say so, you had a news on that as well, some healthusiasm.
Yeah, so basically, most airlines, so I don't know if anyone has ever had an emergency on an airplane, but I've been called for 3. They weren't all international flights, but 2 were national flights that I was on. And most of the time when you're actually called for it, you get basically a packet or a backpack of things that you can use to see the patient, etc. On one of the flights, I remember this was like a national flight, but it was going between New York and San Francisco, so it's a pretty long flight. The idea was to try to figure out, do they actually need to stop the flight and get the person off the plane, right? And so they actually have a way to telephone down to call somebody to make the decision. So in that time, I was actually talking to the person, right? So I'm an emergency room doctor. This is exactly like a perfect doctor to have on a plane, really. And so when I was having that conversation with them, I could tell them, like, this is what's going on. And then they could decide what they wanted to do. Now, that uses a telephone. And so what some planes and airlines are doing in this story is that they're actually going to upgrade that a bit with the type of telehealth they're going to be using, and start actually having video encounters so that somebody on the ground, the physicians on the ground, can see the patient The flight attendants can use the tools they have in the backpack, even if there's no doctor on the plane or nurse or any other clinician, because they're trained in it. And so then they can get more information. And so the whole idea is that by using this, they hopefully will have to ground less planes and stop delays or plane stoppage for this. And they're really just using a type of telehealth that already exists and we use for specialty consultation. So that's really interesting.
Was it mentioned which one that would be used, or?
Yeah, I think it's Delta. And so they're going to which company? It's like a company that does specifically this.
Yeah. Okay. Very good. And Delta is always very hot. I mean, I think they have even a chief health officer at Delta. So they're really very much focused on health and what they could bring to their customers. Other two companies I want to talk about that are very much focused on health and their customers is Google and Microsoft. First of all, Google. Google this week, they brought on a new tool, which is called AlphaMissense, if I pronounce it correctly. It's part of Google Deepmind. We talked about earlier about AlphaFold. Remember, I think AlphaFold is already in the Hall of Fame of Healthusiasm, I guess. But they actually, AlphaFold is a blockbuster algorithm, as they call it, who could predict the 200 million, I believe, protein structures out there. And so now AlphaMissense, which is a new algorithm, can sequence DNA and actually work out the different mutations that DNA might have. So it helps to identify diseases easier. So I'm not a specialist in this area, but if I read here what's in my note, what I understand from it is that each building block of a protein is based on a 3-letter DNA code. And so if you change one of these letters, that protein becomes a mutant of itself. And some mutants might work, but some mutants might actually trigger a certain disease. The problem is that even if you sequence it, there's about 70 million different possible DNA swaps that you can have in a human genome, 70 million. So it means it's kind of hard to understand what actually could be the cause of that. And so with this new tool, they will be able, AlphaMissense, they will be able to more easily understand what mutations are caused to or are linked to what disease. It's not exactly there yet for diagnosis, but it will certainly be like, they called it a tipline for disease-causing mutations, which was pretty amazing. I mean, we often talk about how these big companies like Google, the tech companies, shouldn't be in healthcare, but if you see what they're doing with this again, this is pretty impressive. Also impressive were the plans of Microsoft that also were shared this week. They teamed up with Paige, written as Paige, they call themselves a leading disruptor in healthcare technology, which I believe they could be, because they created the world's largest image-based artificial intelligence model. So basically what it is, it's a massive collection of over 1 billion digitized microscopic images of a variety of different cancer types. So a whole bunch of images on different cancers, and they'll be using the supercomputing infrastructure by Microsoft. And with this, they'll be building an entirely new AI model that will be the foundation for new clinical tools and markers to actually help and improve our fight against the disease cancer. So two huge companies, tech companies, making some strides with AI in healthcare. Going to another huge company, Mo. Of course, I'm not talking about you, but definitely you wanted to bring something up about a huge company.
Well, why not? I don't mind. Well, for me, innovation is more integration than novelty. Yeah? When I hear a news where people say we're the first, I'm always curious because, first of all, I want to discover it. And secondly, I might want to debunk it. But today, the enthusiasm I will be sharing states that two private equity-owned companies are on the verge of creating what they say is the first health platform as a service. Aditi, let me know later if that's just a title or if it's really true. It's HealthComp and Virgin Pulse. They're set to join forces in a monumental $3 billion merger. Their aim is to to create an all-encompassing employer health benefits platform that promises to revolutionize healthcare for millions. HealthComp, on their side, is supported by New Mountain Capital, and Virgin Pulse is not part of the Virgin Group anymore. It's backed by Marlin Equity Partners in 2018, and they're coming together to serve a whopping 20 million members and over 1,000 self-insured employers. But that's not all. There are other people sitting at the table which ring a bell. Blackstone and JP Morgan Chase healthcare investment arm, Morgan Health, are also hopping on board as minority stakeholders. Now, why did I find this interesting? Because, it's happening at a time where private equity deals in healthcare are showing some interesting trends, because the pandemic, as we all know, caused a surge. We've seen a dip recently, and it means that dynamics are shifting a little bit. We're getting out of that dip where private equity is willing to invest again in a more enthusiastic outlook for health investment. So a major healthcare merger that could reshape the landscape of employer-sponsored health benefits, and more especially a new dynamic in private equity trust in healthcare.
Interesting. And definitely worthwhile discussing maybe in another podcast as well. Healthcare as a service. I don't think they're the first one, honestly, but let's bring that up in another pod. Okay, to close out these Healthusiasms, I, as per usual, has a quick fire of unusual ones, 3 to be exact. The first, I'll go to TikTok. We talked in previous episodes about Barbie Core, which has about 1 billion views. We talked about the vagus nerves, which has about 150 million views. Go to these episodes to see what we're talking about there. But this time I want to talk about a hashtag that has 6 billion views, which is called Shower Talk. Shower Talk. Any idea what it could be? It's about showering, obviously. But there is one particular one that has 300 million views, which is right now growing enormously, which is Everything Shower. The Everything Shower. Mo, you had any idea what it could be?
No, I know TikTok is little dances and instructions, and maybe it's something, instruction that you need to do. All the things you could do under the shower that you don't have to do outside of the shower. Maybe that's something.
No, not really.
Okay.
But it could be. Aline, what do you think? Well, Everything Shower, it's a weekly head to toe routine. No, it features hair masks, exfoliating scrubs, having oils, moisturizing balms, all those kind of things. They film it, which is kind of crazy if you think about it. But the whole thing, the Everything Shower, is supposed to take 4 hours about. 4 hours. So it's considered as some homage, if you will, to the bathing culture, using hyper stylized self-care products, accessories, what have you all, to turn the bathroom into a space of wonder, relaxation, and escapism. 300 million views. It's amazing what we see on TikToks. Second unusual one was that scientists apparently have grown an entity that closely resembles an early human embryo. What's so special about it, Aditi? What do you think?
Of finding an original human embryo?
Yeah.
Well, I mean, you could find a lot of data about their DNA if you can extract it and try to figure out what they look like, what diseases they had, find out a lot more about humans lived at that time, right? Because the way that we try to figure out like anthropology and archaeology, it's really a lot of guessing about what people ate and what they did. So
Yeah,
actually having their
that's
DNA
definitely
is
true.
fascinating.
But the thing is, here in this case, they grown it themselves. So how did they do it? They did it without using sperm, using eggs, or even using a womb. So it's sort of an embryo model, as they call it, made by stem cells. So it's basically a textbook example of a real 14-day-old embryo, and it even reacts to a pregnancy test. So it reacts positively to pregnancy, which is pretty amazing. And the idea behind it is that apparently in the first 2 weeks of pregnancy. This is a very a moment where a lot of change is happening. And so what you try to do with this type of embryo model is try to understand major sources for miscarriage, birth defects, etc. So pretty interesting. I mean, to me, not being a scientific person, that was pretty remarkable. An embryo made without using sperm, eggs, or womb, just made from stem cells. And then the third one, maybe. Aditi, you're not impressed, right? You're on mute.
Yes, that was great. I was muted. No, I was saying it is impressive they were able to do it, but we've gotten a lot better at figuring out what stem cells and what we can do with it. So in that way, it makes sense that they were able to.
Yeah, true.
I'm not saying it wasn't a feat. That is a lot of work, and very interesting that they could.
I just like the title of the article as well. Without using sperm, eggs, or womb. If you're not in the scientific field, it's like, whoa. Aline, what do you think?
Was it actually related to what we discussed a few episodes ago about making that embryo or that future person ideal?
It wasn't the purpose for human enhancement. It was really to understand sources for of miscarriage, actually. So, but you can imagine that that it will also be used for some human enhancement in the future, for sure. Last one, Mo, you'll love this. What are exercise mimetics?
Exercise mimetics is things that
you love it,
that will replicate it without doing it.
Yeah, exactly. The magic solution, the magic pill you're always talking about. People are lazy. They only want the magic solution. And we talked about it in previous episodes with Ozempic, reducing appetite, making you lose weight and all of that. Well, apparently, in the Journal of Pharmacology and Experimental Therapeutics, there's a new compound that led obese mice, so we're still talking about mice tests, that led obese mice to lose weight by convincing their bodies and the muscles in their bodies that they are exercising. So it's really they mimicking an exercise, and it apparently boosts metabolism. It increases endurance, so which is pretty impressive if you ask me. So we're talking about how big Ozempic is, and so imagine now if this turns into a drug candidate, a pill, maybe even preferably over an injection, maybe as Ozempic right now is. And you just don't have to work out anymore. You just don't have to do any exercise anymore. We're getting to that phase, Mo, where you say people are lazy and it just needs a miracle pill. Well, they're working on it.
Yes, I don't know if that could ever work.
It is not the FSAP. No, it's the fitness service as a pill. The FSAP. I don't know. Aditi, you were cautious about that. You don't think it will work.
It depends on what they're trying to do exactly, right? Are they just trying to build muscle? They're trying to get mental health to be better? Are they trying to improve lung capacity? Better sleep? What is it that they're trying to actually get through the exercise? Because there's a lot of benefits to exercise that can't really be built with a pill. And so it's what is it mimicking? It's probably not doing everything.
No, it's about boosting metabolism, endurance. That's what I read, and they actually lose weight because of that as well. And I found it. I mean, obviously the article was very clickbaity, if you want. Mm-hmm. But having talked about Ozempic, which is also some sort of miracle jab, I find it pretty impressive that certainly this type of things then get into the media as well. Well, thank you all for that discussion. Thank you for these Healthusiasms. Now let's move to the next segment of the Healthusiasm podcast. Is it something, nothing, or everything?